Thank you for choosing our practice and considering us for your dental procedures. This is the post-operative instruction after sinus grafting. Bleeding. Please keep the gauze in place for 30 minutes and dispose of it afterward. When you return home, consume soft, cold foods for the first 24 hours, and then begin taking the prescribed medications. Oozing and bloody saliva may be normal for up to 14 days. If bleeding persists, fresh gauze, place it over the extraction site and apply pressure for 30-minute intervals until bleeding stops. Discomfort and swelling is normal after dental procedure and last a few days up to 2 weeks, but most of the procedures are not causing significant discomfort. Medications. Ensure you fill all your prescriptions before leaving the office and follow the instructions on the labels. Never take medication on an empty stomach, as this may result in nausea. If nausea occurs, please contact office for prescription. Do not take the listed medications if you are allergic. Sleeping. If there is a need to modify your sleeping position, Dr. Falla will provide instructions. Diet. Consume soft, cold liquids while your mouth is numb, protein shake or yogurt. After the numbness subsides, transition to very soft foods. Anything you can eat with a plastic fork is suitable, and it doesn't have to be only liquid. Maintain a nutritionally balanced diet. Avoid skipping meals. Swelling. You may experience swelling and discoloration around the surgical site. Apply an ice pack to your face with gentle pressure for the first day. Swelling, if it occurs, typically lasts for 72 hours, and the prescribed medication aids in the healing process. Rinsing and oral hygiene. Do not use a straw for drinking during the first 2 weeks. Avoid forcefully spitting saliva, and after brushing, letting it flow out with your mouth open over the sink. Refrain from vigorous mouth rinsing on the day of surgery or any time when there is bleeding. There is no need to use warm salt water. Brush remaining teeth and avoid touching the surgical site. Surgical site. Avoid monitoring the healing by taking pictures or examining the area in the mirror. Do not touch the graft area with your tongue or fingers. Do not pull out your lip to inspect the area. Smoking. Refrain from smoking for the remainder of the surgery day. It is strongly recommended not to smoke for the first 2 weeks post-surgery, as smoking can hinder healing and affect the outcome of the procedure. Quitting altogether is even better. Activity. Avoid physical activity for the rest of the surgery day and the next few days after the procedure. Congestion and bleeding through nose sometimes happen. Sutures. All stitches are dissolvable. If you notice a sting in your mouth a few days later, it's normal. Dr. Falla will notify you in advance or after the procedure if long-lasting sutures were used. Questions. Please review your insurance policy and treatment plan with our patient coordinator for any financial inquiries. Ensure you fully understand the recommended procedure by discussing it with your dentist and Dr. Falla before signing consent forms. At the end of your appointment, you should have extra gauze, post-op instructions, and medications if needed. Feel free to call the office during business hours if you have questions or problems. After hours, you can reach Dr. Falla at cell number. In case of difficulty breathing or emergencies, dial 911.